purpose of our research was to study the health experiences during pregnancy and delivery in people with autism. And specifically in this study, we're looking at pregnancies in Sweden for about the last decade. The purpose of this research is we unfortunately know very little about pregnancy in autistic people. But in general, we know that in research and in services, a lot of money and effort is really focused on children in autism. So it makes sense. We know relatively little about the pregnancy period. And we also know that women are a really understudied group in autism. So together, all these things make it easy to discount the portion of the population that does bear children. But autistic people are getting pregnant. And as a little bit of a teaser to our results, we found that 0.6% of all the deliveries in our study, so again, this was in Sweden from 2011 to 2020, were actually to autistic people. And this is the same as the estimated prevalence of autism in girls in 2010 from the Autism CDC data. So we have reason to believe that the rate of pregnancy in autistic women or people is about the same as the rate of prevalence of autism in women. So this work was performed with colleagues at the Karolinska Institute, and we used several of the national Swedish registers over there to examine deliveries from 2011 to 2020. We used the National Patient Registry to ascertain autism status, and we included people who ever had a diagnosis of autism. So we examined 4 groups of people experiencing pregnancy. The first was people with autism who did not have an intellectual disability. And then second was people with autism who did have an intellectual disability. The third group was people who had an intellectual disability but did not have autism. And then our final group was everybody else who experienced a pregnancy during this time. So first, we saw a later initiation of prenatal care for autistic people. And having a prenatal visit in the first trimester, which is best practice and suggested for everyone, was less common in autism, especially in people with autism and intellectual disability, than it was in the general population. Second, certain health conditions were more common in autistic people during pregnancy, including obesity and pre-eclampsia. These conditions and other things like this can make pregnancy riskier for both the mother and the fetus. Third, certain delivery outcomes were more common in autism. This included premature delivery, lower Apgar scores at 5 minutes, and induction of labor. Autistic people also had longer hospital stays during their delivery, and the majority of people had stays longer than 2 days. And 2 days is sometimes a marker of sort of the standard length of delivery care. Finally, there were some notable things that were not different in our study, particularly the mode of delivery. So either a vaginal or cesarean delivery didn't really vary much across these 4 groups. And while we did see that prenatal care started later in people, especially with people with intellectual disability, the total number of visits was actually very similar across all 4 groups. We know that accessing comprehensive healthcare can be challenging for autistic people, so we need to take steps to ensure appropriate support is available for autistic and other neurodivergent parents. We found some evidence that certain risky health conditions and delivery experiences are more likely on autistic people, and this might support the fact that healthcare needs to be improved for this population particularly. While we can't see from our study and from this data what's causing the differences that we see, we can hypothesize that more comprehensive care and better, more targeted support throughout the whole pregnancy process could improve pregnancy health and the whole pregnancy experience for people. So there's many key issues that should be highlighted that are of importance to pregnancy and the pregnancy experience of autistic people. These things may not be of such great importance to other populations, so it's really important that they need to be explicitly stated when we think about autistic pregnancy. They include perinatal mental health, pregnancy-related trauma and fear, barriers to accessing family planning, and the intersectionality with other marginalized identities. This last one is probably something that varies by country, but common ones might include race and ethnicity, income, and country of origin. And then finally, the way that we perform research can also be influenced right now at this point. This is the time to include autistic research partners and community advisors, and it's also a time to start some qualitative assessment and including participant perspectives. This can really help right now to give direction to the quantitative inquiry that people like myself are starting to pursue. Some of the next steps of this research are to really understand the service experiences of people, to see if there are key differences in the type of care that's being received during pregnancy and how this might impact maternal and fetal outcomes, at the time of delivery. The ultimate goal of all of this is to understand how services and how people are interacting with the system to ultimately improve it.